Therapist at Muscular Dystrophy Queensland. Over to you, Lisa.
Thank you. So I'm here to talk about exercise, okay? So I'll just make sure I can get my computer to work. So here is just an overview of our team. So Lynn's the head physio in charge of us, and Janine, Joe, and myself are the other physios, and we have occupational therapists and allied health assistants. So let's get stuck into it and talk about exercise. So today I'm going to just cover the benefits of exercise, the different types of exercise, and the application to neuromuscular diseases. So the general benefits of exercise, okay, so it's well documented that exercise helps control your blood pressure, prevents obesity, so weight loss, reduces your risk of osteoporosis, so that's when your bone density reduces. So it reduces your risk of heart disease, helps control pain from arthritis, reduces your risk of type 2 diabetes, and some forms of cancer. Okay, so with exercise, there is a lot of evidence that it reduces your risk of falling, and there's certain types of exercise that really targets the balance, and we'll go through that in a bit. They found that there's a release of serotonin with exercise, and that helps with anxiety, depression, and pain. And there's also evidence coming through about the risk of cognitive issues and dementia later in life. So they say exercising in your middle ages helps reduce your risk of dementia later in life. So it also, there's a response in your metabolism as well with exercise and the energy used by the muscle fibers that impacts the muscle force production from muscles. Okay, and this is as they generally increase in size with exercise, and also strengthening counters muscle loss or atrophy. Okay, so if we go on to looking at the specific benefits to neuromuscular conditions, so we're looking at minimizing muscle loss due to non-use. So we can't change the pathological process, but we can help maintain whatever muscle you have, and also prevent muscle decline from non-use. So non-use means general muscle loss from not moving. So people, even without neuromuscular conditions, can have muscle loss due to non-use from when they're just being sedentary and not moving. Okay, and we want to prevent and delay the secondary complications from having a neuromuscular condition. So we want to reduce the risk of contractures and postural deformities. So that's involved in stretching and positioning with your contractures. And postural deformities is like thinking about things like scoliosis. So in conjunction, obviously, with equipment and wheelchairs, you can reduce the risk of these deformities. You're not going to stop it completely. But we do look at exercising. There is benefits at reducing the severity of the contractures and the deformities. Neuroprotective effects, that means is more for our neuromuscular conditions that affect our nervous system. So motor neurons. So as you exercise, more motor neurons fire off. So they think that neuronal sprouting and things like that can occur, where nerves grow off from the nerves to other parts of the muscle. So the part of the nerve that's still working is where the sprouting occurs. And we also like exercise to maximize our functional abilities. Okay, so it's all about maximizing what you can do and preventing the loss of function. Okay, so whether it's you're looking at transfers, you're looking at short distance walking, or if you can walk outdoors or indoors, it's all about trying to work out what exercises you need to do to maintain what you can do and prevent the loss of function. And also just looking at your general quality of life. Okay, so targeting exercise that you enjoy, exercise that you'll do frequently and that you're capable of doing to maintain your quality of life and what you enjoy doing. So let's dive into the types of exercise. So when we think about exercise, we think about aerobic cardiovascular exercise. We think about resistance, strength training. We think about balance exercises, stretching. So people might hear range of motion as well, that comes under that banner. And also hydrotherapy. So we need to highlight this in big highlighter because this is what we commonly prescribe a lot of in neuromuscular conditions. Okay, and hydrotherapy is a combination of all of the above. Okay, so you can do aerobic, you can do strength exercises, you can do balance exercises and stretching in the pool. You can do it all in a great environment, and I'll explain later why hydrotherapy is so good. Okay, so let's start off with aerobic exercise first. So this is a type of exercise that provides cardiovascular conditioning. Okay, so when you do this type of exercise, and it's like walking, cycling, rowing, swimming, generally your heart rate goes up and your breathing goes up. Okay, so it kind of, your heart's a muscle, and all the muscles that control, your breathing is also controlled by muscles as well. So it exercises your muscle of your heart and your lungs, your chest more than anything. Okay, and so the general recommendations put out for everybody includes 30 minutes, 5 days per week of moderate intensity. Okay, so they do recommend that for certain types of neuromuscular conditions, but not all. Okay, and for the 30 minutes at once, that's probably not practical for a lot of people. Okay, it can be broken down into smaller lots. So it can be broken down into 10-minute intervals or even less if you need to. And it doesn't really matter if you don't hit that 30 minutes overall per day, well, per 5 days per week. As long as if you do something, is better than nothing. Okay, and when we do aerobic exercise such as walking and cycling, we think about the intensity. Okay, so when you go see people out in society, they will buy Fitbits or they'll get Apple Watches and things like that, because they use it for exercise to measure their intensity from their percentage of maximal heart rate. So that's 220, take your age, and then you times it by a certain percent. Okay, it is not good to do that if you're on any type of heart medication, but there's another way of measuring your intensity that we use a lot in people that have cardiac changes and respiratory changes and the neuromuscular world, and it's called a rate of perceived exertion scale. Okay, so here you can see a nice scale, and it's got from 1 to 10. Okay, so 1 is the lightest possible, very light activity. So you're not exerting yourself. You feel like you're breathing like you do when you watch TV. And 10 is your maximum effort that you can't keep going with. Okay, so 10 is like you're completely out of breath, you can't talk, and you can't maintain what you're doing for very long, maybe a minute if you're lucky. Okay, so when we look at this scale, we tell people to go between the blue and the green, so 2 to 6. So you're aiming for light to moderate activity. So this means when you're walking, you can feel yourself breathing heavy, but you can still hold a conversation with whoever you're walking with, or when you're cycling on a bike. Okay, and you can talk a sentence and then you breathe and talk a sentence. Okay, so what you're able to do at moderate intensity is different from anyone else in your family. Okay, so everyone's level of what they feel at that green level of 4 to 6 is different. Okay, so you really got to only judge yourself and don't compare to anyone around you, even if you have people in your family with the same condition. Okay, everyone's levels of rate of perceived exertion is different. Okay, but you just got to think for yourself about when you're doing activity, you know, can I feel like I'm breathing heavier and I can still talk a full sentence? You might need to talk to yourself, but that's okay. But you really got to think about, so in the neuromuscular world, they kind of, the maximum is the green level, okay, is that moderate activity level, okay? Some conditions, it's the light activity level, okay? So really don't go beyond the green. It's like the traffic light system that they use. So looking at different types of aerobic exercise, there's portable pedals, okay, that you can use in your own chair, and even exercise bikes like you would get at the gym. So if you have balance problems, I wouldn't recommend using treadmills so much, or cross trainers, because of just getting on and off and the safety of it. So we use cycling a lot. Okay, so cycling is really easy to use. You can get portable pedals and put it anywhere and do it in the comfort of your own home. There's generally different types you can buy. There's better quality ones that have a little bit of resistance in them. But if you've got access to a gym, like try and find a bike with a chair with back support. Okay, especially if you get back pain, it's always good to find a chair with back support. So looking at to assisted aerobic exercise, okay, so if you're not capable of cycling by yourself, this is a motor-med, okay? So we have one of these in our gym. So what it does is you can set it so you do 20% of the work and it does 80% of the work. So you kind of, it assists to cycle. So for people that are really weak, it's great to use one of these devices. It's very hard to get them through NDIS, but people have. I personally haven't got anyone motor-med. And the other thing is a light gate system over the treadmill. Okay, so for people with impaired balance, there are big rehab gyms at hospitals and other places like that have light gates that they use on the flat ground and over treadmills. Basically just suspends you and takes your body weight off a little bit. And also if you fall, you're not going to go anywhere. So moving on to strength and progressive resistance training, okay? So when you see those two words, it means the same thing generally. So this is exercise that involves different exercises where your muscle is contracting to lift, pull, push against a force, okay? So you might be lifting dumbbells or pulling against a resistance band, okay? Or you might be using putty in your hands to exercise all the little muscles of your hand that control your fingers, okay? Or you could be doing exercises laying down on your bed, lifting up your leg. So lifting up your own limb weight, and also standing and doing squats or other things, or sit to stands, and you're working against your own body weight. Okay, that's the hardest kind of thing you can do. But and the exercises for strengthening can be performed in sitting, standing, and lying. Okay, so you don't have to be able to stand and exercise. So you can do strength exercises lying on your back or lying on your side in bed. Okay, so if you have a hard time exercising and standing, there's plenty of other things you can do. Okay, and strength prescription with resistance training can be generally 8 to 12 reps of 2 to 3 lots or sets. Okay, but that's not a set amount you have to do. A lot of physios and exercise physiologists and say, well, you got to do 8 to 12 reps to gain muscle. Okay, but within the neuromuscular world, you're trying to maintain the muscle. Okay, so you don't necessarily have to do all that reps and sets. Okay, if you feel pain, you don't want to generally push yourself super hard. Okay, but even doing a couple of lots of 6, you're still working the muscle, you're still feeling it. Okay, so don't be put off if you can't do the exact amount someone gives you. At least if you try, you're going to get some benefit. Okay, examples of strength training. So here is a pelvic raise for the core and the glutes. Okay, so simple laying down, and you can do this on your bed. Okay, so many of our patients do not get on the floor. This is just an example of the exercise I pulled from the internet. But you can certainly do that on a bed. Okay, and the other one below it is a resistance band. So that's a blue band, which is quite moderate resistance, and the person will be pushing down against it. So that works the front of the thigh and the back of the hip a bit. Okay, and so there's other things you can do like lunges standing up. For some people with myotonic, we might do things like that. And also, if you're able, some people are able to get on their hands and knees. Doing this on their bed to work their arms is an option, and we can modify that slightly as well. So also going to the gym and doing very light weights. Some people choose to do that we see. So you can do lots of cables and things. So the cables are like, you can do for your arms, exercises with the cables or the resistance bands. Okay, so you can replicate it all at home. You don't have to go to a gym. And the other picture there is hand therapy. So those putties are all different levels of resistance. So you generally do different exercises to improve your dexterity and your grip, okay, to help you do functional things around the house, like picking up cups or opening your door with a key, things like that. So, you know, muscles are all over your body. Big thing is not to forget the hands as well as everything else. So the next thing to move on to is balance training. Okay, so this is a bit different from strength training, okay, because this is exercise that targets your sensory systems. So your vision is somatosensory. Somatosensory means all the nerves in your legs and your arms giving feedback to your brain. Okay, so it tells your brain where your body is in space. Okay, and your vestibular system's your inner ear. So people that get inner ear problems, they start walking a bit funny, losing their balance because it's affecting their vestibular nerves. Okay, so when we practice balance exercises, all those systems fire off and give feedback into your brain. Okay, you balance through your ankles, so your ankle muscles do fire off when you do balance exercises, okay, and other postural muscles that keep you upright. So you generally do a lot of balance exercises standing upright or sitting, and that does fire off your postural muscles as well. Okay, so there is a lot of research out in the general population that balance training prevents falls. So doing a couple of lots of sessions of balance exercises per week has reduced the risk and lowered the actual frequency and falls of a lot of populations. Okay, within the neuromuscular population, I'll explain later in the research bit, but there's not a lot of evidence to support this as yet. And when you do balance exercises, it needs to be targeted. So what you have problems with. So if you got problems turning around in your home and things like that, you know, you need to practice turning. So the recommendation's a couple of lots per week. So here's some examples. So we use foam a lot because this changes how the nerves fire off. So it makes your vestibular system work a bit harder. Okay. And then we can use other equipments like the big therapy balls, okay, Swiss balls, and do different arm exercises on that to improve your sitting balance. Okay, so and when it comes to children, there's lots of fun activities you can do with hula hoops and, you know, collecting different objects around, as well as going along balance beams. So it can be really fun type of activity to perform. So stretching is the last type. So stretching increases your flexibility and your extensibility of the muscles and tendons, okay? So it prevents secondary changes such as contractions. It is good for pain relief and maintaining of positions, okay, positions in bed, in your wheelchair, okay, so it's all about promoting comfort. Okay, stretches should be held for at least half a minute. Okay, you can go for longer, long as if you don't cause pain, just a gentle pull, and 2 to 3 times per muscle group. Okay, so a couple of lots per muscle in the one session. Okay, and you can even split it up and just do arms one day, legs the next. Okay, the aim's for 2 to 3 times per week for stretching. So the stretching examples, so top picture on the left is passive stretching, so someone doing the stretch for the person. So we do this a lot in neuromuscular world. And also the hamstring stretches is the middle picture, is being performed by someone else. And the other one's active stretching, so the person does it themselves. Okay. The last thing is hydrotherapy. Okay, so hydrotherapy provides a gentle environment that enables weaker individuals to perform exercises that they can't do or they should not do on land. Okay, so it reduces the load or the force required by the person to complete an exercise, okay, because of buoyancy. So buoyancy helps you move your leg, your muscle doesn't have to work so hard, okay? So all the types of exercises I've just mentioned can be performed in water, okay? And it's a lot easier to perform them in water, okay? But it's just a lot of effort to get to the pool with the whole getting in, getting out, and changing. So that can be a little bit tiring. Okay, so here's a picture of a girl collecting a lot more in shallow water with the kids and make it loads of fun. So these pictures are examples of someone doing leg exercises in the pool. So they're doing active exercises where the child sitting on the board is balance and trunk control. Okay, so moving the board and getting the child to hold their trunk. So you're kind of playing seesaw and all that sort of stuff. So the other examples here is doing some active exercises with equipment. So noodles are great. So they provide a tool to do arm and leg exercises, as well as dumbbells, okay? But dumbbells are a bit harder to use. There's more resistance out of a dumbbell. So I would start with noodles first. And we also do a lot of passive treatment, so a lot of floating and a lot of stretching with people lying on their back. Okay, so it helps them to relax, gets them into a position that they can't achieve on land, and then you stretch them out, and it's really relaxing and feels great, especially if you use a wheelchair. So the applications to neuromuscular disease, so you've got to have individualized exercise plans, okay? Every type of muscular dystrophy is very variable. It's not a one size fits all, okay? And hydrotherapy and stretching is applicable to most types of neuromuscular conditions, okay? And we provide these services most frequently to all of our clients. Strength and cardiovascular exercise requires a baseline of movement to complete, but it can be highly modified to people's limitations, okay? So you've got to think about what's your goals, okay? What are your goals in regards to exercise? How does it fit into your lifestyle, your family's commitments, your work commitments? And who needs to support you when you're doing your exercises? If you're not, you need an assessment before you start a program. And if you need support, you got to have a carer or someone in your family to support you when you're completing them. So the big caution sign here is to avoid over exercising. Okay, so always seek advice and an assessment before you start exercising, or if you haven't done exercise for a long time. Okay, start small and progress the amount and the frequency of your exercise slowly to avoid severe fatigue. Okay, so it should not cause long lasting pain and fatigue. You should be able to carry on with your daily life after a short rest following your exercise session. So you know, you can't do a bout of exercise and then not do anything for 2 days, okay? Because you're not satisfying all the other goals of your life, okay? So make sure you really think about your goals and what you want to achieve for that day, that week, and how exercise falls into that. So you've only got a certain amount of energy, and this is when fatigue and pacing management comes into everything. So do not exercise and then go out, okay? I always tell people to exercise later on in the day if they have to go out in the morning. Okay, and you should not fall after exercise. So if you're going and doing an exercise session and then you're stumbling, you need to tell your allied health professional that you are stumbling, having near misses, or falling, so they can modify your program. Okay, and you should wake up the next day feeling refreshed. So in regards to the research, there's a Cochrane review that was done a couple of years ago now that reported there was very low level evidence of the benefit of aerobic and strength training on strength and aerobic capacity in those with neuromuscular conditions, okay? But they found moderate strength training did not worsen the disease, okay? And that's not for everybody, that's only for certain types of, you know, you can generalize that into. But the only thing is with research is these are rare conditions, okay? And so for someone to do a randomized controlled trial and say, yes, this works, you need huge numbers of people and you need a significant improvement in outcome measures. So what they measure at the start and the end. Okay, so with neuromuscular conditions, you're not going to get huge changes in people. You will get small changes, but it's not going to be a change that they will say, yes, this works, we can use it for everybody. They did do a recent pilot study, okay, which can't be used to generalize to everybody, but they called it a BFit program, and it showed improvements in aerobic fitness. Okay, it involves 3 weekly sessions over 4 months of aerobic exercise. 75% was low intensity, 25% was moderate. Okay, and this was 2 to 3 bouts of 10 to 17 minutes. That's when it was low, and 3 to 8 when it was moderate. That should be moderate. Okay, but with 3 to 4 minutes of rest in between each bout. And so with that prescription, they did find a small improvement in aerobic fitness. Okay. But they only had a certain particular types of neuromuscular conditions, okay, as well. So they did not have all the types that we see. And also like to talk about sport, okay, especially if you have kids and children and people growing up with neuromuscular conditions, this can motivate them a bit. So Queensland Power Chair Football Association and the wheelchair rugby is 2 areas to look at. So here is some of the reference that I just spoke about with regards to the Cochrane review. Okay. And just a couple of slides of how you can connect with us. So if you want to know any more specific details about your exercise, feel free to email us. I'll be happy to answer any of your questions. Send you an article or 2 of your specific condition if you want to know more. So there's a picture of the team and all the services we offer. Okay, so they're in the pool doing a hydro session update. So hydrotherapy is, it's just one main form that can apply to everybody, but it has to be individualized and, you know, safe, all those sorts of things. Oh, and that's the end. So coming up next is Janine Anderson from the Sunshine Coast talking about mobility aids. Okay, well, thank you for your time. Do you have any questions?
Thanks, Lisa, that was incredible. And yeah, if you do have any quick questions, I know the temptation is probably to really go into a lot of detail around your particular condition, and it's probably going to be a little bit tricky to give a proper answer in such a short space of time. But we are here, as Lisa said, if you would like to email us or call us on our info line, we can you know, send you that information and really give you that individualized sort of care. But yes, if you do have any quick questions, feel free to either just pop them in the chat now, just type them in, or you might also like to just quickly come off mute and have a quick little chat. I'll just give you a few seconds to do that. Just in case anyone's madly typing in their question.
I do splurt out a lot of information in a short period of time.
That's where that exercise party would be good for the typing, wouldn't it?
Well, yeah, can't forget about any muscle.
Right.
But I guess the main thing is encouraging people to exercise, and anybody can exercise within their own limits. And I knew there was someone with the Duchenne boy on here, and you know, stretching is just as important as other types of exercise. And you know, and it's hard to motivate children to stretch sometimes, but the pool is a great way to get that stretching in there.
Well, if no one has any questions, we might leave it there for today. But please do feel free to reach out to our team, and you know, if there's anything we can do to help, or you've got some real specific questions, we are here for you. So either give us a call on 1-800-676-364 or email us at info@mdqld.org.au. But thank you, Lisa, and thank you everybody for coming along today. And we hope to see you at the next session in a fortnight's time.
Thank you. Thanks for coming.